I just want to highlight that it is very important to get a face-to-face appointment with your GP. Do not let the receptionist or anyone in your GP surgery tell you that no, you cannot get a face-to-face appointment. It is actually within your rights to get a face-to-face appointment if you do request so. You need to know your rights as a patient. So if, for example, you have any condition, whether it's a chest cough, knee pain, back pain, skin problems such as eczema, you find that your surgery might initially book a telephone appointment. This is okay as part of a triaging session because there is a shortage of face-to-face appointments and your surgery needs to know whether this validates your request for a face-to-face appointment. So that is a good initial first step because it helps to weed out the cases that do not actually need a face-to-face appointment. Because as we know, there are lots of requests for face-to-face appointments. It could be something such as, oh, I need a new prescription for my antidepressant, or I want you to sign this form. So a lot of face-to-face appointments are wasted and they're not saved for those that do actually need it. So this is where a telephone appointment as a triage becomes necessary. But I stress the point as a triage because a telephone appointment should not be the be-all and end-all. If you have the initial telephone appointment where the doctor now feels that this should be a face-to-face, the doctor would usually book you as a face-to-face appointment, and the urgency of that face-to-face appointment depends on the condition, whether it's a chest infection, difficulty breathing, or any other type of condition that requires an urgent appointment. However, if you've seen a doctor for a telephone appointment and you feel that you as a patient needs a face-to-face appointment, but for some reason the doctor is declining that, you can actually take this above and complain either to the practice manager or what we call the practice ombudsman if you feel that the practice manager is not responding appropriately to your complaints. However, the reason why I'm stressing about face-to-face appointments is that we've seen a lot of cases where patients have been misdiagnosed over the telephone. They've been told they have something when they have something else. Like, how would a doctor be able to examine you over the telephone without seeing you in person? Now, I'll give you a brilliant example. Now, there was this gentleman, middle-aged gentleman. He had red swollen leg. So he was diagnosed as having a leg infection called cellulitis. Now, with cellulitis, this is something that can be easily treated with antibiotics. So he had a course of antibiotics over the telephone. Mind you, this was not even a video consultation. So he had a course of antibiotics over the telephone. The symptoms did not improve. Went back to the GP again, gave him another second course of antibiotics. Symptoms did not improve. Being frustrated, he went to A&E. When A&E saw this condition, they thought, oh, okay, actually, this doesn't look good. Let's do some blood tests. So when he did some blood tests, it turned out that he had a blood clot. However, because time had elapsed, it had been a few weeks before complaining about pain and swelling, it now turned out that, the leg had to be amputated. So now the patient's got one leg. Now, this is something that could have been prevented if the doctor has seen the patient in person 4 weeks earlier and has sent the patient to the hospital to have blood tests and even a scan that would have shown a blood clot in the leg known as a DVT and given medication to prevent the blood clot from permanently damaging the leg. So that is a good example. Other examples are numerous. There's a case where, a patient had symptoms of, heartburn at night, ulcer symptoms, and it was treated as an ulcer with medication such as omeprazole. However, it turned out that the patient actually had cancer. And one of the red flag signs is heartburn at night that has persisted for several weeks. It's very unusual to have heartburn at night. And that has to be checked to make sure that is this a bacterial infection or is this cancer? However, the point that I'm making is that these patients really should have been seen in person as a face-to-face appointment rather than as a telephone or even a video appointment, because video can be limited, depends on the bandwidth. You cannot really examine a tummy on video, can you? And sometimes when you're looking at the leg on video, the picture can be quite deceptive depending on the quality of the video. So usually when you're looking at a blood clot, I'll usually have to measure both sides of the legs. If it's 3 centimeters bigger than the other, is it warm to touch? Can I feel any pulses? These are the sort of examinations that you cannot do on video. So if you're having issues having a face-to-face appointment, speak to your practice manager, speak to the practice ombudsman, or even you can call NHS 111 who can on your behalf request a face-to-face appointment.